Welcome back to Fox on Health Weekend. I'm Carol Iavana. Chemical peels have been the fountain of youth for years, erasing the fine lines, wrinkles, and sunspots on our faces without surgery. But what if we could dip our entire body in these potions? Here to tell us about total body peels from Columbia University Medical Center is Dr. Bruce Katz. Welcome to the show, Dr. Katz.
Thank you, Carol.
Okay, we hear so much about what the peel can do for the face, as we just mentioned, getting rid of wrinkles and skin spots and fine lines. What really happens? Can this really happen to the entire body? It seems almost too simple.
Well, we've actually found that by combining two different types of medications, an alpha hydroxy acid and a chemical called 5-FU, or 5-fluorouracil, we can actually remove fine lines, age or sunspots, and smooth the complexion, and at the same time take away precancerous and sun-damaged cells. And we do this by applying it to the face and also the body too. And I think it's really the first time we can actually treat the body for sun damage, whereas before we used to treat the face and people would like to have their wrinkles treated. Now we can actually do the entire body, and we call it a total body pulse peel.
Now, we want to show some pictures and get into other things, but one of the questions I'm going to be asking you about, of course, is this notion of the precancerous cells, and I want to talk more about that. But we're looking at some video here, so you're giving us sort of the lineup of how this is done. So walk us through it, doctor. A patient comes in, and what happens?
Well, the first thing we do, and people ask us all the time, well, who's a good candidate for this peel? And anyone who's had any degree of sun damage, if you've had some bad sunburns as a child, you can benefit from this peel.
Now, what are you applying here at the moment?
The first chemical is a medicine that takes away the oils so that it doesn't block the effect of the peel itself. We take the oils away first, and then you can see we apply the alpha hydroxy acid, and that is one of the medicines that has the effect. After that's applied, we then use the 5-FU to finish off the peel, and we do it on the face, the arms, the chest, and even the legs.
All right, so you come in and you get all this applied to your body. How long does it take?
It takes about 20 minutes to do. We usually have people come in once a week, depending upon the amount of sun damage they have, for either 4 weeks or up to 8 weeks if they have a lot of sun damage.
And it takes 20 minutes, and how many visits? I know you're talking about in terms of weeks, and that's once a week they come in, is that?
They come in once a week, and usually, depending upon how much damage there is, we have them come in maybe 4 times. If they have a lot of damage all over their bodies, they'll come in 8 times. But the great thing about it is that they can go right back to work the same day. There's no redness or irritation. It's truly a lunchtime peel. So there's really no downtime at all.
And of course, that was the big draw for the facial peel. Women on their lunch break would go and get the facial peel done. Let's talk about the precancerous cells. Explain to us how you remove that.
Well, the great thing here is that the medicine itself gets into the DNA of just the damaged or precancerous cells, but leaves the normal cells alone. So that's why there really are very few, if any, side effects. Some people get a little bit dry and they just use a little bit of moisturizer, but for the most part, they can't even tell they've had it done. And it destroys, according to our studies at our Skin and Laser Aesthetics Center, it destroyed about 90% of the sun-damaged cells, more so than alpha-hydroxy acid peels alone or any other treatment we've tried before.
But when we say, I want to be clear on this, when we say precancerous, are we talking about something that is predisposed at this point? I mean, because you've had skin damage, you are assuming that this could be cancerous. This is not something that has been tested for and shown to be cancer?
Well, these types of growths on the skin are usually predictably developing into skin cancers in maybe 20 or 30% of the cases. So by destroying them and by having this pulse peel, we hope to prevent skin cancer from developing in the future in a lot of people.
Okay. Can we talk about the cost?
The cost really is not considerable at all. Depending upon how much of the area of the body is treated, it'll vary from $175 to about $250 a treatment. The total treatment is probably less than the cost of a camcorder. And certainly if you can prevent skin cancer, a lot of people are well willing to have that done.
Do you think that the word is getting out? Are more and more people coming in for body peels as opposed to facial peels?
Well, we've actually been very surprised by the response. And I think a lot of people, not knowing what to do for sun damage on areas of the body, now know that they have a treatment and there's no downtime. They can come in and have it done really at lunchtime.
Okay. Dr. Katz, thank you.